You've probably heard this word from many popular celebrities too.
About bipolar disorder.
You say you now live with bipolar.
Bipolar disorder psychotic symptoms आने लग गए थे.
Have you ever wondered what exactly this is? Even the most famous people get caught in its web. And if someone is dealing with it, can they come out of it? Hello, everyone. I am Dr. Sayed M. Quadri, a U.S. board-certified psychiatrist, and I have been working in the mental health field for the past 20 years. Today, we will understand and discuss bipolar disorder in detail. You may have seen many people whose moods change rapidly. Sometimes they are in extreme high energy, and sometimes they feel completely depressed. These ups and downs are not just simple mood swings. These could be signs of bipolar disorder, which is a mental health condition affecting millions of people worldwide. Let's understand this in more detail. Bipolar disorder, previously known as manic depression, is a condition that takes your mood from extreme highs mania to extreme lows depression. This condition can impact your daily life. During the mania phase, you may feel overly excited, energetic, or even irritable. You have so much energy that you don't even feel the need to sleep. On the other hand, in depressive episodes, you may feel extremely sad, hopeless, and drained, and sometimes even experience suicidal thoughts. Bipolar disorder is a lifelong condition, but the good news is that it can be managed with long-term medication and therapy. The solution for its treatment will also be provided in this video, so be sure to watch it till the end. But before that, we need to understand its symptoms. The symptoms of bipolar disorder are divided into several parts. Let's understand them one by one, starting with the symptoms of mania. During a manic episode, a person experiences sudden extreme energy and excitement. As this state progresses, their behavior becomes impulsive. They feel as if there are no boundaries, and everything they do will be perfect. This heightened sense of confidence or power can lead them to make decisions that may be dangerous for themselves or others. Some common signs of mania include such as feeling overly happy or excited as if life has become perfect. Next, irritability without reason, behaving rudely or hostilely with others. Next, racing thoughts that move at lightning speed. Next, feeling extremely special, powerful, or unique, grandiose beliefs. Next, high sex drive or compulsive sexual behavior. Next, talking rapidly and excessively, making it difficult for others to keep up. Next, risk-taking behavior, such as making large financial decisions without thinking or putting oneself in physical or emotional danger. Next, excessive use of substances that harm health like alcohol or drugs. Next, sleeping very little, yet feeling full of energy, as if sleep is unnecessary. All these symptoms indicate that mania is a serious condition that requires proper management. Hypomania is a milder form of mania. In this state, a person feels more energetic and productive, but it's not as disruptive as mania can be. Hypomania doesn't affect daily functioning as severely, but others might notice noticeable changes in behavior. Some common symptoms of hypomania include such as feeling overly happy, excited, and energetic, as if you are focused on a new goal. Next, a sudden boost in productivity, which can become obsessive or unhealthy. Next, a tendency to get distracted, making it difficult to focus on one task. Next, becoming overly involved in an activity or interest, causing other tasks to be ignored. Next, needing less sleep but still feeling fresh and energetic. Next, a sudden boost in self-esteem, feeling very capable or confident. Next, talking rapidly and excessively, making it hard for others to keep up. Hypomania symptoms might not be noticeable to you until someone points them out. However, this condition can develop into more severe mental health issues over time, so timely diagnosis and management are crucial. On the opposite end of the spectrum from mania and hypomania, depression leaves a person emotionally and physically drained. During this phase, life feels meaningless, and interest in activities fades away. In some cases, depression can lead to suicidal thoughts or self-harm. Common symptoms of depression include such as changes in appetite, leading to weight loss or weight gain. Next, a heavy mental cloud, making it hard to focus or remember things. Next, constant fatigue and low energy, feeling exhausted all the time. Next, feelings of guilt, worthlessness, and helplessness, making life seem pointless. Next, sleep problems, such as insomnia or excessive sleeping. Next, losing interest in activities that once brought joy, now feeling boring or meaningless. Next, persistent sadness, anxiety, or feeling empty that lasts for weeks without a break. Next, Suicidal thoughts or attempts make depression a life-threatening condition. Some people experience manic and depressive symptoms simultaneously. For example, even with high energy and ideas, they might feel anxiety and sadness. Sometimes a high mood episode can follow a low period or vice versa. It's also possible to have mood shifts within a single day or even more frequently. If you or someone you know is struggling with these symptoms, don't ignore them. Treatment for bipolar disorder is possible, but the first step is to seek help. Recognizing and understanding these symptoms is crucial. There are several causes of bipolar disorder, but before diving into the reasons, let's explore its types so you can identify which type of bipolar disorder you or someone you know might have. According to experts, there are different types of bipolar disorder, such as bipolar 1. This type involves manic periods when you feel very up that last at least 1 week. During this phase, symptoms are so intense that medical care might be necessary. Depressive episodes can also occur, and in some cases, manic and depressive symptoms appear together. If there are 4 or more manic and depressive cycles in a year, it's referred to as rapid cycling. Next, bipolar 2. This type involves mild hypomania that doesn't disrupt personal or work life and doesn't include delusions or hallucinations. If hypomania symptoms last for at least 4 days and you've experienced a major depressive episode, you might be diagnosed with bipolar 2. Next, cyclothymic disorder. This type includes hypomanic and depressive episodes lasting for 2 years in adults or 1 year in children and teens or longer. The symptoms aren't as intense as those of bipolar 1 or 2, making it harder to diagnose. Now that we've understood the different types of bipolar disorder, let's explore the reasons behind its occurrence, or, in other words, the risk factors. Risk factors for bipolar disorder are factors that increase the likelihood of developing this condition. Their presence raises the risk, but it doesn't guarantee that you will develop bipolar disorder. They only make you more vulnerable. Family history. If a close relative, like a parent or sibling, has bipolar disorder, your risk increases. This is due to genetic reasons, but having it in the family doesn't necessarily mean you'll develop the condition too. Next, traumatic events or stress. Experiencing traumatic events like emotional, physical, or sexual abuse can increase the risk of bipolar disorder. Excessive stress, such as the death of a loved one or financial problems, can also trigger symptoms. Next, use of drugs or alcohol. Excessive alcohol or drug use can raise the risk of bipolar disorder. These substances can worsen mood, and some medications can have side effects similar to bipolar disorder symptoms. Next, brain function and chemical imbalance. The brains of people with bipolar disorder work differently. Imbalances in brain chemicals like serotonin and dopamine can make mood swings more severe, intensifying the condition's symptoms. Next, major life changes. Major life events like marriage, a new job, or relocation can increase stress, raising the risk of triggering symptoms of bipolar disorder. These are some of the risk factors that can increase the chances of developing bipolar disorder. Now, let's learn how bipolar disorder is diagnosed and the age group in which it is most commonly seen. Bipolar disorder typically appears between the ages of 15 and 24 and can last throughout life. It is rare to see new cases of bipolar disorder in young children or people over 65 years of age. Symptoms vary from person to person and can change over time. Sometimes symptoms are mild, while in other cases, they can be intense periods that challenge your work and daily life. Diagnosing bipolar disorder takes time, as its symptoms can resemble those of anxiety, ADHD, and depression. There is no blood test or brain scan for this condition. Initially, doctors perform a physical exam and ask about your symptoms, medical history, and family background. Sometimes lab tests are also conducted to rule out other medical conditions. You may then be referred to a psychiatrist who will explore your moods and thoughts in greater detail. The doctor assesses the severity and frequency of your symptoms and makes a diagnosis based on the DSM-5 guidelines. Once diagnosed with bipolar disorder, the biggest question is how to manage and treat it. Now, let's explore the treatment options for bipolar disorder and how to control its symptoms. Based on your symptoms, the doctor may suggest the following treatments. Like 1. Medication. Medications are essential for managing the symptoms of bipolar disorder, but they can vary for each individual. Therefore, it's important to consult with your nearest doctor or psychiatrist so that they can create the right medication plan for you. 2. Talk therapy. Talking with a mental health expert can help you understand and manage bipolar disorder more effectively. The doctor may recommend some therapies, such as cognitive behavioral therapy, CBT. This therapy helps you understand the impact of your thoughts, feelings, and behavior and guides you in improving them. Next, interpersonal and social rhythm therapy. This therapy helps improve your relationships and daily routine, contributing to mood stability. Next, psychoeducation. It helps you identify the triggers of mood episodes and manage them more effectively. Next, family therapy. It allows family members to understand the condition and emotions and provides an opportunity to support each other. 3. Electroconvulsive therapy, ECT. This therapy uses electrical currents in a safe manner to alter brain chemistry, leading to an improvement in symptoms. ECT can be an option when other treatments are not effective. 4. Repetitive transcranial magnetic stimulation, RTMS. This therapy uses special magnetic pulses that stimulate the parts of the brain responsible for mood control. It is a non-invasive procedure, meaning it is performed externally and does not require surgery. 5. Light therapy. Exposure to special light affects your circadian rhythms, your brain's internal body clock that controls daily functioning, helping to maintain mood stability. 6. Hospitalization. If your symptoms become very severe, a hospital can be a safe place to stay until your mood is under control. Understanding bipolar disorder is the first step toward managing it. If you or someone you know is experiencing symptoms, seeking help from a doctor as soon as possible is crucial. Early diagnosis and the right treatment can bring significant improvement to your life. If you found this information useful, please like, share, and don't forget to subscribe to the channel. For more detailed information, be sure to check the references below. Stay healthy, stay informed, and take care.